of umbilical cord in a full-time neonate is option A 10 cm, option B 20 cm, option C 80 cm, option D 40 cm. The answer is option D 40 cm. The umbilical cord can be detected on ultrasound by dash weeks of gestation. Option A 2 weeks, option B 6 weeks, option C 10 weeks, and option D 24 weeks. The answer is option C 6 weeks. Umbilical cord can be detected on ultrasound by 6 weeks of gestation and well visualized by 8 to 9 weeks of gestation. The white cream substance on the fetus is called option A white coat, option B milky patch, option C vernix, option D all of the above. The answer is option C vernix. Appearance of violet blue discoloration of the vaginal membrane after conception is known as option A Hagar sign, option B Osiander sign, option C quickening, option D Giacomo's sign. The answer is option D Giacomo's sign. Hagar sign is the softening of the lower uterine segment or cervix. It happens around 6 to 12 weeks of gestation. Osiander sign is a stronger vaginal pulsation caused by increased blood supply in the uterus and enlarged uterine arteries. It happens around 8th week of gestation. Giacomo's sign or Chadwick sign is a purplish or violet blue discoloration of mucous membrane of vagina. It's seen in 4 to 8 weeks of gestation. Quickening is when pregnant women start to feel their baby's movement in their uterus. It feels like a flutter, bubble, or tiny pulses. It happens around 16 to 20 weeks of gestation. Fetal blood flow through placenta is option A 450 ml per minute, option B 50 ml per minute, option C 100 ml per minute, option D 800 ml per minute. The answer is option A 450 ml per minute. The oxygen saturation in umbilical artery is option A 90 to 100%, option B 20 to 30%, option C 18 to 90%, and option D is 50 to 60%. The answer is option D 50 to 60%. The oxygen saturation of umbilical artery is 50 to 60%. Oxygen saturation of umbilical vein is 70 to 80%. Pressure in the umbilical vein is option A 10 mm of Hg, option B 30 mm of Hg, option C 80 mm of Hg, and option D 60 mm of Hg. The answer is option A 10 mm of Hg. The pressure in the umbilical vein is 10 mm of Hg and pressure in the umbilical artery is 60 mm of Hg. Thickness of placental barrier membrane is option A 0.5 mm, option B 0.25 mm, option C 0.025 mm, and option D is 1 mm. The answer is option C 0.025 mm. The amount of amniotic fluid at 12 weeks of pregnancy. Option A 50 ml, option B 400 ml, option C 600 ml, and option D 200 ml. The answer is option A 50 ml. The amount of amniotic fluid at 12 weeks of pregnancy is 50 ml, 400 ml at 20 weeks, 1 liter at 36 to 38 weeks, and at term 600 to 800 ml. The color of amniotic fluid in pregnancy. Option A colorless, option B pale straw, option C green color, and option D is golden color. The answer is option A colorless. The color of amniotic fluid in pregnancy is colorless, but near term the color became pale straw color due to presence of exfoliated lanigo and epidermal skin from the fetal skin. Green color seen in meconium stain is suggestive of fetal distress. Golden color seen in RH incompatibility is due to excessive hemolysis of fetal RBC and production of excess bilirubin. Greenish yellow or saffron color is seen in post-maturity of the fetus. Dark brown or tobacco juice color amniotic fluid is found in intrauterine death.